All right. Hi, everyone. Welcome to your first class of Professional Identity with Dr. Snow and Dr. Lamar. If you can hear me, go ahead and type something into the chat box to let me know. Okay, I'm getting yes, hi, hello. I can hear you. Great. Perfect. Hi, everyone. Well, welcome. I have Dr. Snow and Dr. Lamar on the line as well. And
Hello.
unfortunately, we won't have them over video today, but you'll be able to hear them just fine. So for the first course this evening, for our first webinar, we're going to talk about kind of an overview of becoming a mental health counselor or marriage and family therapist. So this will apply clearly to all of you guys. We'll talk about, kind of the outlook in terms of careers, career options, salaries, things like that. So kind of give you kind of the big picture of what it looks like entering into this field. And so during the webinar, you have listen-only capacity. Since we're in a webinar format rather than a meeting format. So if you have any questions, go ahead and type them into the chat box, or I think there might be a Q&A box. I do see a chat box at the bottom, so feel free to type those in where you've been typing them in already. And then throughout the webinar, or probably more as we finish, we'll have a chance for Dr. Snow and Dr. Lamar to answer any of the questions that you guys might have. So now that you've started your master's program and you're starting this journey, now's the time to kind of get familiar and ask us what you want to know. All right, well, why don't we get started? I'm going to maximize the PowerPoint, and so you won't see my camera now. So hopefully everybody can see the screen. All right, and as we mentioned, this webinar is going to give you an overview of the process of becoming either a mental health counselor. In California, that title is a licensed professional clinical counselor, and a marriage and family therapist. So what we're going to go over tonight is listed here. We'll talk about what is a mental health counselor, what is the scope of practice for this type of profession for counselors and therapists, what are similarities and differences with other professions, particularly in the field of mental health, what do career opportunities look like, what is the market outlook for this field, what are the educational requirements to go into counseling or therapy, what is the practicum experience like, what is supervision like, what are licensure requirements in California and in other states and countries, and then at the end we'll have time for you guys to ask some questions. I think I do see too a couple of raised hands. So again, while we can't use the, you guys don't have the ability to talk verbally over the audio, but you can go ahead and type your questions into the chat box, so feel free to do that. All right, so I'll be moderating our meeting today. You guys, I think I've met all of you guys. I'm Deanna Berger, and I actually was the first graduate of your program that you guys are just starting. And I manage the master's programs here at PAU. And here you can see a photo of Dr. Snow and Dr. Lamar. So you guys probably all know Dr. Snow as well. He's the director of the MA in Counseling and Counseling Psychology programs at PAU. And Dr. Margaret Lamar is an adjunct professor with us here at PAU, and a lot of you guys will have her for the professional identity class. So again, how to interact today at the little question box or the chat box. Oh, I see. Somebody asked, is this the chat box and the questions box? So either the questions or the chat box, either one is fine, and I'll try to get to all the questions as we get to the end. All right, so let's get started with Dr. Snow and Dr. Lamar with the first question. What exactly is a mental health counselor?
Well, I'll get started, and Margaret can always chime in. First of all, the recent definition of mental health counselor from the American Counseling Association, I should say the definition of a counselor from the American Counseling Association really is about professional relationship, empowers diverse individuals, families, and groups to accomplish mental health, wellness, education, career goals. Notice one of the things here is wellness, is that in the counseling model, it's about a relationship that really does promote wellness. We're going to be talking throughout this whole quarter about what really differentiates a marriage and family therapist, a psychologist, a social worker. But I think really that relational aspect and the wellness is a big piece of it. And then also, maybe Margaret, you're a mental health counselor. Maybe you could talk about the second piece of the actual mental health counseling definition.
Sure. Well, you'll notice that the ACA definition, we've been having some great discussions about this in my sections, the section of the course, you'll notice that first definition is really broad. And so I know that some people like the second definition that you may have read about in your book because it's a lot more specific. And it really talks about, it brings in the education piece that I know is important to all of you, that the piece about you know, having an education and being trained and skilled professionals. And then I think, I'm reading it along here with you, that it also talks about, it kind of gives you a sense of what mental health counseling looks like, so that piece around the traditional psychotherapy with a practical problem-solving approach that creates a dynamic and efficient path for change and problem resolution. So it's a lot more specific, and I think gives a picture of what mental health counseling looks like on a very specific level. And I think one thing that we've talked about in my class is a bit about how the ACA definition is broad, because it really is encompassing a whole lot of different counseling professionals, in that it's including school counselors and including you know, college counselors and mental health counselors and marriage and family counselors. So it's including a lot more people, which I think is why it's broad. So that I like them both for different reasons, but I think the second one can give you a nice picture of what it is that you'll be doing with clients.
Oh, wow, and Deanna, we can see you playing with your control panel.
Oh, thanks for sharing. I was just trying to get the chat box going.
One of the things, for those who say, but I want to be an MFT, it's interesting to note that the American Counseling Association, as one of its subcategories, is marriage and family counseling. They're a bit competitive with the American Association of Marriage and Family Therapy, which is its distinct group. But you're going to notice the confusion is that family therapy is both a system of practice, but also within the WMFT, it's a kind of its own profession. But bottom line would be MFTs in California are almost in many ways mental health counselors with a family therapy emphasis to it, because you're going to find them saying, well, we do these things too. So right now, a lot of it you're going to find is trying to be distinct and trying to carve out their niche in the field. So if you're an MFT, you have a broader scope of practice than in many states. So I think clinical mental health counseling, the book we're using, does a pretty good job of showing that there is a distinction, but there's lots of overlap. Deanna?
All right, thank you. So next, can you both talk about what the scope of practice for a counselor or therapist is?
Yeah. Well, so first of all, I can talk about California, maybe Margaret can talk about Texas and also from Colorado. So when we think about, I would say for both MFTs and for mental health counselors, one of the things, the scope of practice is defined by two things. A family therapist, by the way, in California has to have that, what I call couples family systems orientation, where they actually have to think of relationships as part of doing their practice. Conceptually, an LPCC doesn't have to have a relational aspect. So for example, but if we think about life, most problems don't occur without having some kind of relational component. Which was talking with somebody, so what could an LPCC do? So maybe technically, maybe smoking cessation, if they wanted to do that, could be considered maybe not relational, but almost everything. So the issue of assessment diagnosis, psychotherapy, treatment planning, brief, solution focused, almost all of these could be considered in both the mental health counseling and the family therapy field. But you'll notice in California has one distinction. In California, couples and families are seen under the purview of MFTs, but you'll also notice with the law for LPCCs in California with 500 hours of clinical experience and supervision, and I think it's 9 units of coursework, which you get in our program, you can be licensed as an LPCC and see couples and families. So at least in California, the scope of practice has a lot of overlap. Margaret, what do you see in places like Texas and Colorado?
Yeah, I would say the same overlap. In both of those states, the other So in California, you all have the, or we have, I'm here too, have the LPCC. And in other states, you also hear of just the LPC, which is the Licensed Professional Counselor. So if you're in a different state, that might be what you hear is just the LPC. And both the previous states that I've lived in, Texas and Colorado, had the LPC. But it's essentially the same thing as the LPCC. And I think it's sort of the same way that, you know, it's a license and they look more at general hours when you're turning your hours in, and they can all be general, and you could work with individuals, you could be working with couples if you wanted to specialize in that area. And then I think the LMFT is something that, you know, that is an addition to that. So, but there's a lot of overlap in what you see licensed counselors doing. They're also seeing families, and they're seeing couples and kids, just depending on the setting that they're in.
So I think you're going to find this is a very common experience, but part of the professional identity is not just scope of practice, but what kind of camp you see yourself in. But you're going to find that many people are in several camps. For example, if you notice Mark Garrick, the author of your book, he writes a lot about mental health counseling, but he also, if you'll notice, he's a licensed psychologist. So not uncommon for people to have multiple licenses and have themselves in various camps. Deanna?
All right, thank you. So next, you know, in the mental health field, there are a lot of different licenses, a lot of different professions that do a lot of similar work. Can you tell us about the similarities and differences between some of the licenses in this field?
Well, first of all, you know, we can both chime in on this one. So first of all, I kind of put down some of the major ones on the left. Mental health counseling, marriage and family therapy, clinical social work, substance abuse, psychology, and psychiatry. In California, all of them are licensed except for substance abuse. In substance abuse, they actually only need to have a high school diploma, and they can have a certificate. And the way it works in California, it's a voluntary certification. What do they do with substance abuse in Texas and Colorado, Margaret, any idea?
I know more about Colorado than I do about Texas substance abuse, because Colorado also has something similar to California, where they have there they call them well, they're called CACs, and it's a CAC. It stands for something that is escaping my brain right now. But there's different levels, and each level has a different required education status. So some are high school diploma, and some require just an undergraduate degree. And then I think there's some at the very top that are essentially a substance abuse certification for master's level practitioners. So you can have the highest level of I think it's actually certified alcohol counselor. That's what it is. You can have the highest level of that, and also have like your LPC and your LMFT. You can have all of those, and that's just an additional certification that you can have that says you have special training on top of your counseling background and counseling education. You also have training in substance abuse.
Yeah, so in California it's confusing, because when somebody says they're certified, what California requires for addiction is that you seek a voluntary certification from one of, like, I think it's like a dozen agencies, and you have to have it, I think, within like 6 years of practicing. You're not really licensed the same way, and it doesn't really do much going from state to state. The true license are the ones you see on the left-hand side. One of the interesting things is the kind of what I call the training focus. So, for example, mental health counselors, and this is my perspective, is the whole idea of restoration, wellness, holism, are some of the touch points that they really emphasize. They might look like they're doing everything else, but in the training, that wellness perspective, and I would say it's strength-based. Would you agree, Margaret, or would you want to add something to that?
Yeah, I would. I would also add probably the development focus. I know several of you are also in a development class, and understanding the developmental aspect is really important to counseling. And then I know we've talked a little bit about this in our course this week, is that education focus and helping to educate clients as well.
So marriage and family therapy, which has been my traditional background, I had my master's in family therapy. One of the first ones which was, I got my degree in 1981, my master's degree, so you can tell how old I am. But I had one of the first master's degrees in Washington State, one of the newer degrees in the country. Family therapy was very big, but the goal then was that we'd see things in what I call a systemic or relational family systems perspective. And you'll hear words like structural and systemic interventions, people like Jay Haley, Marie Bowen. So really it's a therapeutic style. As I see Californians today, most MFTs are probably not as pure systemically and structurally. In fact, we teach cognitive behavioral therapy. So the relational, in the same way that mental health counselors see themselves as relational, but I think in addition is that they historically have this sort of structural and systems perspective. And let me jump to social work. Social work in many ways, by the way, social worker can do family systems work. They may see themselves into a holistic practice and wellness, but the big historical background are these from these charitable organizations, societies, trying to solve some of the larger societal issues. One of the classic ones in the 1800s was child labor, kids 10 years of age working in factories, and then working with public policy and advocacy to kind of change some of these. Now, social workers, in many ways, drank the psychiatric Kool-Aid when Sigmund Freud and his group came along, and you began this word clinical social workers, but you also began hearing the term psychoanalytic social workers. So social workers, in many ways, now have kind of evolved into kind of several camps, kind of organizational, and there's also these sort of clinical social workers. And let me just mention psychologists. Boy, so what's unique about them? You know, many psychologists may be doing very similar things as a mental health counselor or family therapist is doing. But the one thing that they really have a specialty are things like neuropsych, psychometrics, and testing. For example, the LPCC in California cannot give a battery of 3 or more tests, which means you can give 2 tests, or you can give a test here and there, but psychologists have preserved testing as their specialty. And of course, the one thing that nobody else can do is a psychiatrist or now a nurse practitioner or PA is to give prescription drugs, but a psychiatrist really has that specialty to basically prescribe drugs and medication to help people deal with their mental emotional disorders. Any other thoughts on this, Margaret?
Yeah, well, I was just going to also clarify further because I know there's confusion because, you know, maybe you've seen something in the movies or something about a psychiatrist really maybe doing some things that a counselor typically might do, meaning having sessions with clients, and typically you really don't see that. So a counselor would refer a client to a psychiatrist to get an antidepressant, and that psychiatrist is not going to see, it'd be more like going to see a doctor if you have a cold or something. They're going to just talk to that person real briefly. So they're not really going to sit down and do long sessions typically. So just to clarify that they typically don't. They'll check in just enough to kind of find out what's going on, and then we'll work with that client over months or weeks or years even to make sure that their medication is working for them.
You'll see a few psychiatrists oftentimes on the research side who, quote, do therapy, but that's pretty unusual, mainly because if a psychiatrist walks out the door with a $400,000 student loan, because remember they're doing their 4-year BA, 4 years of medical school, 3 years of psychiatric internship, by the time they're done, they probably can't afford to do therapy even at $120 an hour. So when you see psychiatrists, there are probably some in Beverly Hills who are charging maybe $500 an hour who might be doing this, but you're right. It's going to be hard to find a psychiatrist who actually talks with patients.
All right.
So, Deanna?
Yeah, we have a couple of questions from students. One question is to clarify, when we say mental health counselor, are we talking about an LPCC?
The California equivalent would be the LPCC.
All right. And another question, to clarify, did Dr. Snow say that the goal of mental health counselors is to see problems through a structural systemic lens, or is that the MFTs, or both?
Well, I would say it's the MFT. When they say if you look at scope of practice unique, that's a unique practice. But remember, there are psychologists. For example, one of our professors here, Janet Negley, she's a family systems person, she said it was Jay Haley, who is a classic in the field. So is Sheila Siegel. So we say these, remember, these are all stereotypes. These are broad-based discussions that you're going to find a psychologist who acts more like a social worker, a mental health counselor who does family therapy. So I'm just saying these are what the more distinct perspectives. Your thoughts, Margaret?
Well, yeah, I was going to say, you know, I've worked, not as much myself, but I've known mental health counselors who definitely use the systemic, even when they're working with an individual, they always, you know, it's like it's their theory, and they view that individual client through the view of a system. So they see that individual client in relationship to their family dynamics or what's going on in their marriage and so on. So they definitely use that piece as well.
Good. Other questions, Deanna?
Yeah, another question about clarity about, are you saying that psychologists will begin to prescribe drugs?
You know, there are some states where psychologists are working for drug administration privileges. The U.S. Air Force trained some psychologists to to prescribe drugs. But remember, master's level people already do it. Nurse practitioners have master's degrees. So do physician assistants. In fact, we have a physician assistant at Scotts Valley who's been prescribing drugs. She works in a medical clinic, and prescribes drugs. So it's not unusual, but what I find is this: a lot of psychologists don't want to prescribe drugs because it's another area of expertise, another area of liability. Because it's one thing to say, okay, you weren't very effective in treating my depression, but what if you provide medications and there's a reaction to it? So a lot of psychologists don't see it as a privilege and want to stay away from it. But there are states that are working on that piece. So it's kind of a mixed bag. It's not everybody sees it as something they want to have and they want to do.
Great, thank you. We have a few more questions, but why don't we continue on for sake of time? Sure. And I'll remind the students that you guys do have your individual chat sessions with Dr. Snow or Dr. Lamar as well. So if we can't get to them now, I'm sure that they'll get to it during the individual discussion groups.
Okay, great.
All right. So next, what about career opportunities, right? We all come into this program and with one of the goals of getting maybe a new job in a different field. What are some of the career opportunities as a counselor or therapist?
So Margaret, you want to fill this one?
Sure. There's so many places you can work as a counselor. I think some of the traditional ones are mental health community agencies, and those can be for-profit or not-for-profit. They could be county clinical mental health agencies, or I worked in one that was geared towards victims of family violence. So that would be, it was a non-profit kind of a situation. Hospitals, veteran centers, those are also really great places to look into and to begin just thinking about as you're going through your program. You don't have to commit to any population that you want to work with. That's the beauty of having the mental health degree or the family degree as well. You have a variety of places you can work. School-based mental health, those are typically school counselors, and typically, well, I know, Dr. Snow, you can speak more to this in California. There's a lot of licensing around school counselors in California. Some states it's a little bit easier, but typically you have to do an internship in those settings in order to work as a school counselor.
Yeah, let me just interrupt. In California, we say school counselors. Many of you will internship at schools. That's separate from what they call a school counselor who has a teaching credential, and in California they call it a pupil personnel credential. So if you say you want to be a school counselor, but by the way, that's kind of a dying breed because it's kind of being taken over by LPCCs and MFTs working in schools on contracts. Sorry to interrupt you, but that's just it's an odd, yeah.
Yeah, I knew the ones in California are very different from other places, and they are starting to defund school counseling in a lot of states, so it's definitely something to keep an eye on. College and university counseling, this is sort of my area of expertise, so I was a real big fan of this being on the slide because I think colleges and universities have college counseling centers and career centers, and even in non-counseling centers on university campuses, there's all kinds of opportunities and counseling skills that are needed in working with students. So you can work as an advisor, you can even work in judicial affairs. Those kinds of places are great places. Housing is another one, an area that they're always looking for people with counseling skills. Faith-based counseling organizations. I know some folks in my class are in some of those and have great experiences. And then correctional counseling, and then there's also lots of opportunities to teach and consult and do workshops, and then there's also private practice. So I don't know what else you would have to add to that, Dr. Snow.
Yeah, the one thing is I'd like to tell people, I use this example, we probably have a few students who are about 22 years of age. Social Security for you probably won't come until you're about age 70, which means you're going to be working for 48 years. Most of you will probably delve into a number of these. So when people talk about where do I want to work, if you divide your 48 years up into, let's say, 3 16-year increments, that's a long time. That means when you graduate, you'll be going from 24 to 40 for your first group, 40 to 50, 6, and then 56 to 70. You're going to have you could have 3 careers and 3 specializations. So when you think about it, think about all the opportunities. And by the way, web-based therapy is going to become bigger, the use of the internet in counseling and mental health. So there's going to be more opportunities here that we're going to add probably over the next 10 years.
Yeah, and I would even say, I know lots of people are even working concurrently. So they're working, maybe 4 days a week at an agency, and then they have a private practice an extra day or 2 of the week that they are doing. So they're working in multiple different environments at the same time.
Can I jump in with a student question? One student asks, are these considered career opportunities for both licenses or only LPCCs?
I would say both.
Mm-hmm.
I would say both. And also be aware that besides working in California, the reason we really do push both licenses, if possible, is because California has a very broad scope of practice. For example, if you move to West Virginia, there is no such thing as a marital family counseling license. So you may be not just working in California, you may be working in different states. So in California, you're wide open with the MFT or the LPCC. May be the case in certain states, but I would say things may change. My prediction is eventually there's going to be some kind of a merger taking place versus fragmentation. And also with people doing counseling across lines, for example, if you're doing web-based therapy with a person in Nevada, so does your license in California count? A lot of new implications based upon as the world gets smaller. But yeah, it's open to everybody, but just be aware that every state might be somewhat different. For example, addiction counseling eventually may have its own license because people seem to be looking for ways to carve out niches. Right now, addiction counseling is open to any of these counselors. So at some point, the younger you are, the more changes you will see before your career ends.
Mm-hmm.
Yeah?
All right, thank you. All right, now what about salaries and the market outlook? What can students kind of expect in California and elsewhere?
Yeah. So one of the problems, by the way, with all the research, and this is 2011 and 12 data, but it doesn't include private practice, just to be aware of that. So right now, you worked at an agency.
Mm-hmm.
What are the kind of rates that people charge when you were at Discovery or Christian Counseling?
Well, that's a great one. So at the center that I was at, we had trainees, which are students who are still in school in practicum, and then we had interns, which in California are registered with the board and working towards licensure, and then we had licensed people, and some licensed maybe a shorter time, some maybe licensed for 20 years with specialties and whatnot. So for us, the trainees did not take home any to pay. Some agencies are different. Some might give you, another agency that I know nearby would pay trainees $8 per client hour, so minimum wage per client hour. Some agencies would pay a stipend, maybe $100 or so a month for, to kind of cover your gas. But the trainees were charging between $5 and $25 an hour. And so with getting your first experience in the field, it's also kind of a nice way to give back. We served clients who really couldn't afford more than $5 an hour for counseling, and that for them was a really positive thing that they were able to have that service and have it be that affordable. Once you're an intern, in California at least, you can work under someone's private practice, and the counseling center that I was at was kind of a similar setup. And so interns were charging anywhere between, I'd say, $35 an hour all the way up to $80 or $90 an hour, which is getting close to a license rate. And then at the center I was at, it was a 60-40 split where 40% went to the intern and 60% went to the center to cover your rent and your supervision, office supplies, things like that. And then licensed folks are charging typically $100 to $120 an hour, and then higher if you have certain specializations or if you've been in practice for a long time or if you're in a really affluent area. I've heard in Palo Alto of MFTs charging upwards of about $160 an hour, which is pretty high.
Right. So when you think about the income, and by the way, 160 an hour sounds great, but remember you have an office, you have expenses, but you can do quite well. So when you see the median annual salaries, those are for what are offered for positions. So for example, if they say $68,000 in California for emergency family therapy, by the way, mental health counseling will be very similar because this is a California rate we're looking at the very bottom. Mental health counseling will be very equivalent. And so the thing with California, by the way, tends to have a higher standard of living, higher cost of living, and they tend to charge more. So that's why you see we tend to have higher incomes here. If you look at the outlook, though, what's interesting are the number of jobs that exist and the number of the change. So, for example, 58,000 more mental health counselors in the country. That's 37% faster than normal. Emergency family therapists, about 41%. So between MFT and LPCCs, if you think of this as the national average, it's 40%. One of the things is which states are growing. Well, some of the fastest growing states are California, places like Texas, and so not only are the populations growing, but the market for these. So I'd say that in these fields, it's definitely very strong. Substance abuse, it's actually not a lot of them because it's such a high school-oriented degree, maybe some college, that the income is quite low, but I think you're going to eventually see substance abuse. Doesn't mean that an MFT with a addiction emphasis can't charge more and get more income. But so if you look at the fields, definitely the master's level fields are these two here. Any other thoughts, Margaret, on your?
Yeah, I think
what's it like in Texas? Yeah, go ahead.
I think it's pretty similar. I think in Deanna's point about people who have a specialty tend to or have the ability to be able to charge more. I think if that's something that you are considering is your salary and whether that's going to cover, whatever your life is, whether you have family or not. I think keeping your eyes open during your program for a specialty that interests you. excuse me, whether that be being a really great substance abuse counselor or having a specialty with children or, having an animal-assisted therapy practice or something that really sets you apart. Number one, will guarantee that you can get clients, and number two, could impact, how much you're able to charge in those situations.
And I think, again, as Margaret said, that most people do a little bit of both. They might work in an agency 4 days a week. They might do private practice. So what this doesn't also cover is the person making $68,000 to $75,000, making $20,000 on the side, maybe teaching a class. Because the one thing for me is I was in a private practice in Washington State, and I was bored just seeing clients, hours on end. One of my friends, he saw 30 clients a week, and he thrived on it. But I like to teach a class. I would do counseling. I would do a lot of different things. So for me, I thrive on variety. So it's not just the market. You need to think about yourself, about what's going to make you thrive in the field, persist, grow. And it may not just be working at a particular agency, but it might be having some variety. So I think it's great to teach a class, work in an agency, some private practice. So the variety is how can you pay for that? So I think for me, even the flexibility, For example, I commute once in a while to Palo Alto. If I have to commute at 8 o'clock in the morning, it might take me an hour and a half. Being able to commute over there at 10 o'clock, it might take me 45 minutes. If you're locked in an 8 to 5 job, you may find yourself just really pained by just having to be in that 8 to 5 window. But I think you're going to find in this field it's much more flexible.
Well, I think that also
go ahead, Margaret, go ahead.
Yeah, if I can jump in, the beauty of it as well is, you know, you don't have to necessarily stress about having all these specialties right now. You can just focus on getting your degree and getting out and getting a job, and then looking around for some opportunities to educate yourself or to work with somebody who has a specialty. And maybe you wait 5 years before you do that, or you're in 20 years and then you want to add something else to your to what you know. So I think that's the wonderful part of it, is that you can continue to grow and learn and add new things to what you're doing.
Great.
All right, we have a question about the slide here. It says, what do correctional treatment specialists do exactly? Do they actually do therapy, or do they just assist a licensed therapist?
You know, that's a category, and I think a broad category. And for example, in California, because we have mainly MFTs, we have MFTs doing therapy. On the other hand, Becky Jackson, who was one of our professors, does risk analysis, assesses people for risk in the population. So I don't know, Margaret, do you know much about correctional specialists?
No, I really don't. So I don't know that I can answer that question, but that's something we can look into to answer.
Yeah. One of the things, by the way, I did my first master's project. I got a grant for it on the jail. The one thing to be aware of is that when I have an article actually. It's in a book. It's called Pseudo Offenders: The Mentally Ill in Jail. To be aware that I think I discovered back then my research was that about up to 22% were mentally ill at some level. Depression, anxiety, mental retardation, all kinds of interesting kind of scenarios. And so one of the reasons that you have people in jails is because oftentimes, for example, I had one of my clients who was a friend. He's gone now. His name was Daryl Kyle. He was very borderline IQ, and he was had inherited some money from his mother, was taken advantage of, was beat up. Well, he ended up going to jail, I think because he couldn't defend himself verbally. He's the guy who got beat up, but the person who beat him up said, I was threatened, and so this guy, Daryl, ends up in a state prison. So he's in a state prison. He definitely was probably about an IQ about 70. So there's a lot of these very sad cases, and so you need people who say, well, these people need to be responsible for their actions, but at the same time, while they're there, they need a special kind of treatment. So there is a huge mentally ill population in jail. So I don't know as much about it, but I do know that the mental health population in jail is pretty high. And my guess would be, mine was 22%, and it could be higher.
All right, thank you. All right, so now on to educational requirements for becoming a counselor or a therapist. Can you tell us about those?
This is pretty much a K-CREP kind of model like California. You want to talk about this one a little bit, Margaret? This is sort of a K-CREP model for training.
So if you've read your Chapter 1, you'll have read a little bit about K-CREP, which was developed to set standards for training counselors. So that schools wouldn't just, say, oh, well, you only need 2 classes, and then another school would say, oh, you need a bunch. And as the profession has grown, we've said, here are some of the things that we believe counselors need to know. And so these are based on the K-CREP standards, and the K-CREP standards say, here are some of the things that we think counseling programs need to be teaching to counselors before they're ready to go out into the field. So you'll see these are a lot of the courses that you will be taking, or maybe they're not by name, but the courses that you're taking will cover these different areas. So like you'll take a group counseling class, you're all in professional identity, which would really fall under the professional orientation standard that counselors reach when they go through school. Any more on that, Dr.
Yeah, just be aware that California, when they adopted its LPCC license, really adopted the American Counseling Association KCREF standard. So right now, if you get an LPCC, it's at least KCREF equivalent, and it kind of fits that kind of national model. So the national model is the 90 quarter units or 60 semesters. It's these basic classes. And California went with the 3,000 hours of postmaster's practicum. How many hours is your practicum in Texas? 3,000 is very similar.
So you're talking about practicum like in-school training, in-school?
Like in school during your master's. So what would they consider hours? 3,000?
Well, I guess we would just fall under the KCREP, which is the 600 hours. Is that I'm not maybe I know.
Oh, I'm sorry, but for license, when you your license.
It's 3,000 or it's 3,000 in Texas. It's 2,000 in Colorado, I believe.
Yeah. Right. So people be aware you get your practicum, but then you have these couple thousand hours. The bottom line would be there's a couple cases where, for example, in Colorado, if you had 2,000 hours and got licensed, could you get licensed in Texas? Possibly have an issue?
Well, it would depend on how long you've been practicing. So this is why it's so important for everyone to be looking. If you're thinking of you're going to be living in a different state at some point, it's important to be looking at these requirements because, you know, if you got your license in one state and then immediately moved, you might not be able to do it.
Yeah.
You might have to make up some hours. But if you've been practicing in a certain state for 10 years, then I think the transfer process is a lot.
Right. Yeah, just to be aware, for example, I looked some states that I have in my book, so you only need a 48 semester, 72 quarter unit program. The problem would be you may not qualify in certain states. So I think Margaret's right. Think about where you're going to live. I think pretty much at the 60 semester, 90 quarter with these classes, it fits. It's the 90% solution for all the states.
I've never seen a state that requires really significantly more education than sort of that KCREP 60 semester, 90 hours.
Right. Yeah, I think practicum a little bit different. For example, Deanna, doesn't Florida require 1,000 hours?
Right.
Yeah. So even the practicum piece. So for example, Florida required 1,000 hours versus the KCREP 720. 720, I believe, right, or 700.
Yeah, it's around there, 700.
Yeah. So that's why even those simple things. So it's always better to have more than less.
Mm-hmm.
We have a student question that says, are KCREP educational standards for LPCCs similar to COAMP educational standards for MFTs?
No, because they're similar. COAMP is the only for family therapists, but it has some unique qualifications. For example, COAMP requires you to get, like, I think it's 400 hours of couple and family. The reason that we're not there yet and we're questioning whether you can do it because, for example, in California, most agencies, you don't see couples or families. You see children. And so when we talk with people about how to have a COAMP program, a lot of places actually have to develop their own clinics to be able to generate enough couple and family hours. I saw couples and families at Pacific Lutheran University, but they actually have an outpatient clinic. I think if your experience, Deanna, how many hours do you have so far from your master's?
One. It's not, in my observation, not too common.
Yeah, that's the real dilemma and why a lot of places don't use COAMP. COAMP is trying to carve out its niche, but I think, it would make the program, well, it's not even just a matter of size, but it's just a matter of opportunities for practicums. So we're looking at it, but it's something that has its issues. In many ways, KCREP is somewhat different. They actually have a counseling emphasis that they accredit, but they might be kind of competitors at some level between marriage counseling, marriage therapy. Were you gonna say something, Margaret?
Yeah, I was just gonna reinforce that that's really my experience in other states as well. I think it's just not cost effective for agencies to provide family and couples counseling as much, and so it's very rare to find students who are able to get hours in those areas. So the school that I came from didn't have a COAMP.
Yeah, I talked with a COAMP guy from Washington, and his frustration was, he said, he said, I'm not very religious, and all the sites that do couples and families were like churches and nonprofits that did it like a ministry. They would do like free couples counseling, or they would do low cost. Remember, for most of your mental health agencies, they do what they call is it Medi-Cal billable hours, and those hours tend to be for particular DSM disorders, and couples conflict is not necessarily something that they pay for. They don't necessarily pay for family hours. Plus, for example, when you work with kids, most of the time you might work with families once in a while, but very rarely. And oftentimes when you're working 8 to 5, you're dealing with kids who are taken out of classrooms for treatment. So anyway, it's something that if you're interested, I encourage you to work on getting your experience. Now, by the way, if you want to be a supervisor and go up in the WMFT field, once you're licensed MFT, they'll accept you. So anyway, so it's a long story, but definitely something everybody grapples with, what to do with COAM. Right now we are CACREP focused on meeting those requirements, and because we also believe that by the way, just to be aware, there's 50,000 MFTs across the entire country. About 30,000 are in California. And by the way, California historically has not been a WMFT state because they feel their scope of practice is much broader than what COAM sees and the scope of practice should be for a family therapist. So there's actually some conflict between California's family therapy organization, which is bigger than WMFT. We probably need to scoot along here. I see we're already at 6:49.
Yeah, I'll save the questions for later for the discussion groups.
Okay.
All right. So then now marriage and family therapy educational requirements.
Yeah. One of the things you're going to find is that our program is dually set up for both an MFT in California and for LPCC. The difference is that in our program you take, for the advanced marriage and family therapy, that satisfies the family therapy requirements. And if you want to do the LPCC, you take the career development theories. But we've been able to have our program, which is dual license eligible. So if you really take 95 units, you can be licensed for either of them. So we would say even our mental health program, it's a mental health degree with a family emphasis as well. And that's kind of how we set it up. You're going to be interesting. The LPCC is very much course-oriented. If you go back to slide 1, can you go back 1 slide?
Sure.
To the mental health. If you go back to the slide, for example, group counseling has to be 5 quarter units. Human growth and development, 5 quarter units. Social and cultural, 5 quarter. So all of these are specifically that many units and a specific course because that's a CACREP model. They go back to the MFT. MFT in many ways is a little more broad. It's more general, so that they say you have to have 18 units of marital and family therapy, you have to have human growth, but they don't specify the units per se. What we've done is we've taken all the different requirements side by side, all the state license requirements, and CACREP and said, what do we have to do to make this work for both? And that's what we've done. It's a very common model in California, and I think it works for your benefit, so you can be licensed for both. Next.
Okay. So now practicum experience and supervision?
Yeah, so I'm just going to say the mental health is really the CACREP requirement, 280 face-to-face. And when people hear 700, it's the 420 related to counseling, which is, and by the way, in mental health counseling or the LPCC, these are hours that are only for your masters, not counted for your 3,000. For an LPCC, and in most states, you're going to have 3,000 postmasters. In California, you have to have 225 face-to-face hours, but all of your hours, if you do more than that, can count towards licensure. So the 3,000 in California, the MFT, can maybe, I think it's like 1,200 or more other hours, which I don't know anybody who gets that in their practicum can be counted for licensure. So, but they all need 2 years of post-licensure experience. So no matter what, you're going to need 3,700 really for mental health counseling, and then you're going to need 3,000 including your master's for marriage and family therapy. So they're similar, which means you'll probably get your family therapy license hours first, and then you'll get your LPCC license hours later. So we'll have to kind of, got about 8 minutes, we'll kind of go on to the next slide.
Okay. All right, licensure requirements.
Yeah. So these are pretty common for all of them. It's your degree. It's about 3,000 hours of experience, two years of postmaster's work, passing a state or national licensure test. For example, the nice thing about the LPCC, they use the National Counselor Exam, which is a national test. Once you take it, you're good for your entire life, no matter what state you go into. California, though, has its own family therapy exam, which means that exam is not used in every state. So the nice thing about the LPCC, it's much more portable because you have all the hours and you've already passed a national test. Your experience with Colorado, Texas, similar?
Yeah, very similar. Yeah, we had a state-specific test just to really understand the state laws, but then the National Counselor Exam was the standard test for both of those.
Right. I did forget that in California, so right now what they're doing for the LPCC, you take a law of ethics, which is about California, and you take the national licensure exam and a clinical vignette. So the bottom line would be is that they're very similar. So no matter what state you go to, you're going to find a similar experience. Next.
Okay. All right.
So let's take 2 or 3 questions. First a question I'd like to know from the group is maybe type in your response. How do you like this webinar approach? I wish you could see my camera and Margaret's camera. I actually cleaned my house, swept the floor, put on makeup, but you can't even see that. So maybe next time. What do you think of the format? And by the way, I can't see the responses, Deanna, so maybe you can kind of read some of the responses about the format.
I have one, works great. I like the format, good format. This works well, but I cannot see the response of others. Is that normal? I think so. I think the question box just goes between attendees and panelists because we're using GoToWebinar.
Or GoToMeeting allows you to see the other questions.
Mm-hmm. Yeah, a lot of positive responses. I love the webinar. Format is great. Thumbs up. I like the webinar and the dialogue between instructors. Great.
Good. Well, we can take one or 2 more questions. We want to give a break for 2 minutes because I have a 7 o'clock meeting. In fact, we'll just stay on for this. And so we'll take 2 more minutes of questions, and then we'll break up. So my group meets the Palo Alto group at 7, the Los Altos at 8, and the Scotts Valley at 9. And we'll have a chance to answer your individual questions.
And mine actually is tomorrow, so I'll be sending my information out for that.
Okay. Hey, Deanna, I have a question. Since we're struggling with the camera, is there a way that we can use a different GoToMeeting meeting room? That can be a big headache?
Not at all. No, we can do GoToMeeting.
Okay. So how do we do that? Do we tell everybody? Can we give information out on the webinar? What that's going to be?
Let me give you the presenter control for a second, and let me look up some information, and I'll come back and bring it. Okay?
Okay.
Shall I stop recording here?
So no. Why don't you stop recording? So what we're going to do